should be forgiven for thinking it was an ordinary summer's day on this busy, bustling high street in Birmingham. We're meant to be staying at home. The shops are meant to be shut.
Very busy. At least every 10 minutes, 15 minutes, we have customer coming.
We found a very, very, very long line of people waiting for the supermarket. Plenty of masks, but not much social distancing on display. Trying to police them was Simon, who's volunteering as a security guard.
The queues are just getting ridiculous. There's more people coming out. They should be at home, you know what I mean, doing what they've been asked to do, and they're obviously clearly not listening.
Amid concerns that the public health messages aren't getting through to all communities, the West Midlands has emerged as a hotspot for transmissions of the coronavirus, with a sharp rise in the number of deaths. So why were so many people out and about?
I've got 7 children. I need to feed my children. I've got asthma. My other children are healthy, so I'm putting myself at risk by coming shopping. You know, I have asthma, but I've got this on and I've got these on.
Public health officials worry that gloves and masks are giving people a false sense of security. They stress that hand washing is more effective.
How come you're out today when we've been told to stay at home?
Food shopping.
Yeah,
food shopping.
Yeah.
It's really busy on this high street, do you think?
Just a bit.
Yeah, just a bit. Yeah, a bit too busy, I think. Really, everybody should be staying in as much as they can, but...
Got to get some toilet rolls.
Yeah, we definitely do. So.
As officials urgently investigate the numbers, the sobering news that part of Birmingham Airport is being converted into a mortuary, able to store at least 1,500 bodies, in preparation for a predicted rise in deaths in this region.
It's a bit shocking.
Dr. Seema Bathul is a GP in Birmingham. She says there are many complex reasons that the West Midlands is now considered a hotspot, including high levels of social deprivation.
1.2 million people living in 267 square kilometre area, so the overcrowding is one of the factors. Most of the families are living in multi-generational, homes. The grandparents are also living with them. 15% of population of Birmingham is more than 65 years of age.
In Wolverhampton, this leisure centre has been converted into a giant food distribution centre. They're preparing to send supplies to 33,000 residents classed as vulnerable.
Why do you think the number of cases here is so high?
We were one of the first to have one of the first cases. And so we're perhaps always going to be a few days or a week ahead of people, but other areas are catching up. We also started a superb testing routine.
It can't all be about testing.
I think the testing and the fact that we got early cases, but like I say, other areas unfortunately are catching up on those numbers. But just to reiterate, each number is a person.
Although London remains the epicentre of this outbreak, the West Midlands is, alarmingly for those who live and work here, catching up, with 89 deaths recorded as of yesterday.